Hello, my name is Dr. Nigel Watson, and I'm a GP partner in the New Forest and Chief Executive of Wessex Local Medical Committee. I'm also a member of the General Practices Committee of the BMA. Earlier this year, I was asked by the Secretary of State for Health and Social Care to be the independent chair of a review into the partnership model of general practice. General practice remains one of the most important and respected institutions in our communities. Over 99% of the population is registered with a practice. We know that healthcare systems that are built on strong and stable primary care deliver better health outcomes at a lower mortality rate, at a lower cost, and with less prescribed medication and lower hospitalisation rates, and with greater patient satisfaction. Over the last few years, general practice has been changing, with the average size of practices increasing, and at the same time, the numbers of partners have been falling, with an increase in GPs opting to work as locums. As a nation, we have seen over recent years that a significant increase in our elderly population results in more health and social care needs. This is particularly true in the over 85s. There has also been a significant increase in people with one or more long-term conditions. All of this contributes to the greater demand on the NHS. Over the last 10 years, the increased demand has resulted with an increased proportion of the NHS budget going to hospital-based care at the expense of community services, mental health and general practice. The NHS is widely respected throughout the world as being one of the most cost-effective and efficient ways of delivering healthcare. And the British system of general practice is one of the major reasons for that. Arranging care around a registered list, providing holistic care, looking after the whole patient, GPs working as the specialist generalist, providing care from cradle to grave, the family doctor often knowing several generations of the same family, knowing about their social and healthcare needs, having a lifelong medical record, providing continuity of care where it's appropriate. Sometimes access is more important than continuity. The gatekeeper role still remains an important aspect of having a cost-effective healthcare system. We provide high-quality care but at low cost, and are experts at managing the undifferentiated presentation of symptoms, and also of managing clinical risk. But general practice doesn't work by itself. It is a partnership model in most parts of the country, and the strengths of the partnership model include being a part of the community, embedded in a community, and being accountable to your community, to be able to innovate and implement change at pace, to the desire of a business to succeed, and also provide great value for money. And also general practice enjoys a degree of autonomy, which helps develop all those aspects of partnership. At a time when demand is increasing rather than a growing workforce, the GP headcount is falling. We have a workforce that feels the workload is exceeding capacity, with the working day beginning to feel unmanageable. The intensity of the work and the complexity of patients rises, resulting in longer working days. The risk of being a partner is now seen to outweigh the benefits, and as a profession, many GPs do not feel valued. This has resulted in less GPs becoming partners and more GPs retiring prematurely, with an increase in the prevalence of stress and burnout seen in GPs at all stages of their career. In May of this year, I was asked by the Secretary of State for Health and Social Care to be the independent chair of a review into the partnership model of general practice, and was given the following terms of reference. I was asked to consider and, where appropriate, make recommendations in the following areas. To look at the challenges that face the current partnership model within the context of general practice, but also the wider NHS, and how the current model of delivering services will meet these or exacerbate them. To look at the benefits and the shortcomings of the partnership model and how that relates to patients, partners, salary GPs, locums, other practice staff, and also the wider NHS. And consider how you reinvigorate the model to equip it to help the transformation of general practice, which benefits patients, staff, and GPs. And finally, that these recommendations should be focused, affordable, and practical. Over the last 6 months, the review team have engaged with GPs, practices, organisations, patients and anyone else who wished to talk to us. We developed the key lines of inquiry, identifying the key issues. We then met with groups of GPs, nurses, practice managers and others to develop the recommendations. In October, we published the interim report, which provided more details, and we've now completed the task and published our final report with recommendations. The GP Partnership Review was established as a result of discussions between the Secretary of State and the General Practitioners Committee of the BMA, the Royal College of GPs, NHS England and the Department of Health and Social Care, and aimed to address the challenges and equip general practice for the future. However, it's important to note that we're not starting with a blank sheet of paper. The 5-year forward view was published in 2014 and set a vision for the future with a greater focus on improving health outcomes with the new models of care whereby general practice took a more central role with a commitment to invest more in primary care. The GP Forward View was published in 2016 and committed to invest $2.4 billion per year by 2021 to support general practice. State-backed indemnity was announced to be introduced in April 2019 to cover all those working in general practice to address the increased financial risk for our clinical staff. The premises review is looking at the risks associated with leaseholding and ownership and how those risks can be reduced. And as part of the partnership review, we're contributing to that work. Contract negotiations between the GPC and government are ongoing, with a focus on introducing state-backed indemnity, reforming QOF and developing primary care networks. NHS England's long-term plan will invest an additional £20 billion per year in the NHS, and it will be important to see where this is invested and that it is supportive of primary care. The Prime Minister announced recently an additional £3.5 billion for primary and community care. As yet, we don't know the details of how this will be invested. Finally, we're slowly moving from choice and competition to provider partnerships, with general practice working more closely with other providers. The terminology changes almost by the day, but could be accountable care systems, accountable care organisations, integrated care systems, or integrated care partnerships. The big questions is, are these a threat or are they an opportunity? This is the end of this video blog. In future video blogs, I will cover the areas of recommendations that are published in the GP Partnership Review.